Hello and welcome to The Nation. You're joining me, Elaine Abdullah. You're watching BERNAMA TV. Today we will be talking about a topic that perhaps doesn't get enough attention. We're speaking about lung cancer and its impact in Malaysia. In the studio, I'm speaking to Dr. Toh Lai Man. He is a consultant clinical oncologist and the co-founder of the Lung Cancer Network of Malaysia. Hello and welcome, Doctor. Now,
good afternoon, Elaine.
We spoke about some of the lung cancer impacts prior to starting the show, but perhaps let's share with the viewers out there lung cancer and its impact. Why is lung cancer considered one of the deadliest diseases in Malaysia?
Well, firstly, Elaine, the incidence of lung cancer is very high, especially in the Asian region. We have about 2 million lung cancers in the world annually, but 1.2 out of that occurs in Asia.
That's right. I saw some infographics that came out on that. Well, 1.2 million is in our East Asian as well as South Asian regions, whereas the rest of the world only makes up, that small percentage of the 800,000. Yes. So how is it that we ended up being the largest at risk?
Well, it's a disease very relevant to our population.
Right.
The reasons for lung cancer are multifactorial.
Right.
I mean, smoking being the most common cause of lung cancer. About 75% of our patients have been smokers or heavy smokers, but about 25% of patients have never smoked.
So that's also the big question. I think a lot of people, they have the misconception or perception that only if you're smokers, then you're at risk of getting lung cancer.
Yes.
Otherwise, you wouldn't think that it would affect you, and which also leads to the question of even knowing the symptoms that you might be at risk or you have been exposed, and which results in detection and when you will be detected with the potential lung cancer. So the prevalence of lung cancer in Malaysia, you were mentioning it's higher in terms of the male population.
Yeah, our statistics actually mirror international statistics.
Right.
In men, lung cancer is the most common cancer.
Right.
And it's the third most common cancer overall, men and women.
Right.
Lung cancer presents about 5,000 new cases per year in Malaysia.
Right.
90% of them present at stage 3 and 4.
Right.
Which is a very advanced stage.
Exactly. So that's the question earlier. How is it that we are able to, create a better mechanism for early detection? What are the symptoms? I think you mentioned earlier some of the symptoms, but they seem to be very common ones. Perhaps you can share them with us.
Yeah, the symptoms of lung cancer, unfortunately, can be confused with common ailments such as a simple cough and cold or flu. The symptoms include coughing up of blood, pain in the chest, coughs or fevers that don't go away with treatment, weight loss.
Yep. Right. Now we have some slides coming on. Earlier we mentioned about the 1.22 million in our region. The rest of the world, 470K in Europe itself. Smaller percentage apparently in the Americas at only 252,000, and in South America less than 100,000, and in the Africa region is 40,000. Perhaps do you have an overview of how is it that it's as such in the rest of the world? Do they have better education, or they're less exposed to some of the things that in the Asian region we are more exposed to?
Yeah, in the Asian potentially there may be a genetic link. So there's higher risk of lung cancer if your immediate family has had lung cancer. Right. And some of the carcinogens that we are exposed to are different from other parts of the world, as you rightly point out. Right. Lung cancer can be associated with high temperature cooking in an enclosed non-ventilated environment, and the meats that are produced may contain certain carcinogens, and as you know, wok frying is very prevalent in the Asian context.
Right. So the way we like to eat definitely may affect us as well.
But I think by and large, we need to remain focused on the fact that lung cancer is a disease that is caused by smoking. And we certainly, as a doctor and co-founder of Lung Cancer Network Malaysia, we're extremely supportive of the brave moves by the MOH to reduce smoking in public areas.
Yes.
I think that's a very bold move by them.
Exactly. But speaking of that, I think we still lack a lot of enforcement to ensure that this is carried out. I mean, as we sit around, we still see people ignoring gigantic signs that says that you are going to be fine if you smoke, but they still continue to do it. Is there a lackadaisical attitude then?
Yeah, I think that's where programs like this will help. I think programs like this raise the awareness, raise the general perception of the public that, look, you know, it's a disease that's serious, but actually we have a lot of treatments for lung cancer these days. The overall view of lung cancer survival is very different compared to a decade or even 2 decades ago.
Yeah, let's look at those numbers. I've seen some numbers that came out on certain slides saying that the prognosis for like the 1 year post-diagnosis survivability versus a 5 year, the lung cancer patients have one of the lowest, if I'm not mistaken, about 11% survivability of the first year alone. In the past, I think it was even less than a year.
Less than that, yes.
What are the statistics showing right now, and what are the improvements?
So the traditional statistics for lung cancer are that the 5-year survival rate is less than 5% for late stage, and it's about 11% overall.
Right.
So compare that with someone who gets prostate cancer in Malaysia, 73%. Right. Breast, 67, colon, 57. We're a long way away from the other cancers, and our survival is behind other countries, for example, Japan, which is around about 44%. Right. So we are behind these countries, partly because of late diagnosis, partly because our therapies have not caught up in the past, but things are changing.
Now, we have this slide on 90% of all lung cancer cases diagnosed at late stages. You mentioned at stage 3 or 4. As you can see here, those circled, 66% in males, 71% in females. How do we change these statistics?
Partly is awareness of the symptoms, and the symptoms is what we've spoken about. I think the public should become a bit more aware that if you have these symptoms that may indicate lung cancer, it's best to get checked out by a healthcare professional earlier rather than later. I think also the awareness needs to improve in terms of the general healthcare professionals. Average GP may not see that many lung cancers a year, but we want to raise the awareness of the possibility of lung cancer. The other way we can do that is early detection by low-dose CT scanning for at-risk individuals. So certain individuals 45 to 75 years old who have smoked 20 to 30 years a pack a day qualify for a screen using a CT scan, but a very low-dose CT scan.
Should that be something that people should request for?
It's certainly being offered by the Lung Cancer Network Malaysia in conjunction with 7 hospitals for Lung Cancer Awareness Month, November.
How much would the cost be for something like this?
500 to 1,000 ringgit, but it's offered FOC.
Oh, wow.
Free of charge.
There you go. Cancer awareness. Thank you for Lung Cancer Network Malaysia for creating this opportunity. So anyone out there right now who wants to get screened for this low-dose CT scan, is that what it's called?
Go to our website, download the free voucher, and there are 7 participating hospitals.
What is the process like? How long does it take?
It takes 15 seconds.
Wow. 15 seconds only.
1 breath hold, painless, no injections.
So what can you see based on this scan?
So potentially these scans will pick up small tumors, tumors which have no symptoms. So we want to pick them up early. And if they're picked up early, the cure rate for stage 1 and stage 2 is 80 and 60% versus the 5% that we talked about.
Wow, that sounds like amazing numbers. We'll take a short breather right now. Later when we come back after the break, we'll talk about some treatment options available, including immunotherapy, which you say is changing the post-cancer survivability. Stay tuned, we'll be right back with that and more. Hi there, thanks for staying with us on The Nation. You're still with me, Elaine Abdullah, on BERNAMA TV. Today we're speaking about lung cancer awareness. November is Lung Cancer Awareness Month, and in the studio I'm speaking to Dr. Toh Lai Man. He is the consultant clinical oncologist and co-founder of the Lung Cancer Network of Malaysia. Dr. Toh, I heard we have good news because you mentioned that there is a free CT scan, low-dose scan, which means there's less radiation, in order for you to do early detection, which is always the mantra, early detection saves lives.
Absolutely.
With regards to lung cancer, which has a low prevalence of exposure and awareness amongst the public. A lot of people are aware of breast cancer. Maybe they are a little bit more vocal. But right now, lung cancer, usually the silent killer among men, has to be a little bit more vocal. So we're empowering men out there to get this free scan that is available for both November and December. And you said that, how do you go about it? Going onto the website?
Lung Cancer Network Malaysia website, 45 to 75 years old, 20-pack year history of smoking, download the free voucher, 7 participating hospitals.
Right, so no excuse not to be able to go because it's free. Free. Best way to be able to help promote this message out there. Get your people and your loved ones to go out there and get the scan. Early detection is always the best. Now, if you have been diagnosed with lung cancer, what are the treatment options available? In the past, I mentioned that I have had relatives that have been diagnosed with lung cancer, and within 6 months, mortality rates are really high for lung cancer. Right now, you mentioned that there are new treatments that prolong the survivability post. Immunotherapy gives new hope to patients. So what are the various treatments available right now for lung cancer patients?
10% of lung cancer will be diagnosed at an early stage in Malaysia. For those patients, they are potentially cured by surgery or radiotherapy.
Okay.
For the remainder of the 90%, about 50% will be suitable for targeted therapy. So treatment to using specialized drugs that target specialized mutations.
Right.
The other 50% are suitable for immunotherapy.
Okay.
So this is a completely revolutionary field. We know that lung cancers hide from our immune systems.
Oh.
So actually there's nothing wrong with our immune systems in terms of they are intact.
Right.
But it just cannot detect these cancer cells that are hiding away from the immune system, a bit like a Trojan horse.
So essentially, the lung cancer cells are very good at camouflaging themselves, making our body think that we're fine, and they don't have to we won't have to employ our immune system to fight it.
Correct.
So
absolutely.
What does the immunotherapy do?
So immunotherapy basically unmasks these cancer cells.
I see.
So it's just like being at a camouflage masquerade ball. Everyone's wearing a mask, including the bad guy. Police come in, can't see the bad guy.
Right.
Immunotherapy goes to the bad guy, takes off the mask.
Right.
Police can see the bad guy, gets rid of the bad guy.
Right.
So that essentially is immunotherapy. And it's a treatment that is very convenient and easy to deliver. It's an outpatient treatment.
Right.
Once a week, patients come in for infusion that lasts an hour, and then they go away and get on with their lives.
Right.
The side
For how long?
effects,
How many? You said once a week. For how long?
it depends on the situation of the patient.
Right.
Each stage and each patient has a different duration of treatment. It could be from 1 year to 2 years or even longer in some cases.
What is the success rate of the immunotherapy so far? What does the statistics show?
In a disease where majority of patients don't make it beyond a year,
Correct.
or even 2, lung cancer immunotherapy has allowed 30% of patients who are suitable for treatment to live 5 years.
Wow, okay.
So that has completely changed the field.
That of course changes the prognosis, because I think most people, the moment you hear that you get lung cancer, it's sort of like a death bell. You don't have much time left. You're just getting your affairs in order. But now there is opportunity for you to have some kind of healthy, sustainable way of living for the next couple of years.
With very few side effects.
And with, like you mentioned, very few side effects, because let's talk about the other treatments available. What are the other treatments that are still in play? Not all patients respond to, like for example, immunotherapy?
Not all patients respond to any therapy we deliver to them. There are potential mechanisms where they become resistant to the treatment.
Correct.
So we're just getting started with immunotherapy. We're finding different ways to combine immunotherapy with traditional chemotherapy at a lower dose, radiotherapy, and all these seem to augment the response to our treatment. So we're getting better and better as we go along.
Is it still very much case-by-case basis? Because I think a lot of people, when they are diagnosed with cancer, feel that it's even worse to actually go through chemotherapy or radiotherapy because of the side effects that they will have to experience. What would your advice actually be? I
think that's true if that statement was made maybe 10 years ago.
Right.
Or 20 years ago.
Okay.
I mean, chemotherapies have advanced as well. So the standard chemotherapy that we deliver for patients with an adenocarcinoma, for example, you won't lose your hair, vomiting is very rare, patients carry on with their jobs, their lives, looking after children with good quality of life.
Right.
So I think things are changing, and we're beginning to combine that with our newer treatments,
Right.
immunotherapy, for example.
So perceptions should be changed because a lot of people, I think, still think that, you know, if you go through chemotherapy, you'd rather not, you know, have any sort of treatment and
Yes.
take whatever comes. And I constantly hear this kind of conversation out in the public, if, you know, whether or not you make the choice to want to or not. So as in the medical profession, as an oncologist, you would recommend to seek the best professional treatment advice, and taking those treatments is recommended.
Speak to an oncologist,
Right.
someone who treats lung cancer
Right.
regularly.
Right.
Get good advice.
Yeah.
Perhaps maybe place a bit less emphasis on what is out there in the public space, which sometimes can be a little bit outdated or exaggerated.
I think one of the things that's perhaps lacking is survivor stories with regards to lung cancer, because it's harder for patients to trust what the medical profession is going to tell them, because they're not the ones that's going through it, and therefore they think that, oh, you don't know what I'm going through, I don't want to go through it. But perhaps a survivor will be able to give them some perspective on what's next.
I think you've hit the nail on the head, absolutely. I think at Lung Cancer Network Malaysia, we're trying to address that. So we all of us in the network have patients who have survived, 5 years, 10 years, going strong, living productive, healthy lives. And I take your advice, we will get that message out there.
All right. We'll take another short breather. When we come back, we'll speak more about fighting lung cancer together. Stay tuned. We'll be right back. Hi there, thanks for staying with us on The Nation. You're still with me, Elaine Nobla, on BERNAMA TV. We're speaking to Dr. To. He is the consultant clinical oncologist as well as co-founder for Lung Cancer Network of Malaysia. Today we're talking about the topic of lung cancer. November is the month of awareness for lung cancer, and there has been a program that's ongoing. If you want to find out whether you're at risk, you can actually get a free CT scan at participating network hospitals, just going to their website. Dr. To, now let's quickly talk about fighting lung cancer together. It's a collaborative effort. It's not just a one person. Your surrounding community and network can assist with creating awareness, highlighting symptoms, offering solutions, and perhaps leading you in the right direction. So November is Lung Cancer Awareness Month. How can we, the public, ourselves, help to reduce the lung cancer incidences in Malaysia?
I think for fear of sounding like a preacher, stop smoking.
Okay.
I think that's the...
Now, speaking of smoking, what about vaping? Because a lot of people are swapping smoking for vaping, thinking that it's probably the better option or the better alternative to smoking. So what are your thoughts on that?
It's certainly marketed as such, isn't it?
Right.
But I think the jury is still out. We've had a series of reports from the United States.
Yeah.
For vapors having severe lung injury, one even requiring a lung transplant.
Right.
So I think certainly there are some chemicals in there which are questionable, which may potentially cause harm, but I think further studies need to be done. In terms of lung cancer, for example,
right,
you don't see the effects of lung cancer for a lag period of 20 years.
Right, okay.
So if someone were to have a heavy vaping smoker history, we're looking at maybe 10, 20 years down the line before we start to see lung cancer cases emerging.
Right.
So I think the jury is still out.
Right. So, but is there any comment with regards to whether vaping is actually better than smoking, or because you're talking about lesser of two evils, people always pit it as such?
I don't think we have that evidence to say that. So,
okay.
Yeah.
Essentially, doctors' advice stands: stop smoking, inclusive of vaping.
eat healthy, get out and exercise, and live a healthy, productive life.
And lead a healthy, productive life. So what can the public out there do to raise awareness about cancer? So I think sharing symptoms, perhaps. What are the core symptoms that people should look out for?
Yeah, I think just to reiterate, symptoms such as persistent cough, infections that don't resolve, pain in the chest, coughing up of blood, weight loss, you really need to see a health professional and raise the question about whether this could be lung cancer. Of course, in Malaysia, diseases like TB are having a resurgence. So it could be an infectious cause, but certainly lung cancer has to be at the top of our mind in such people. I think as a community, we should also band together and support causes like our Lung Cancer Network Malaysia, which hopes to raise the profile and awareness of lung cancer to the level of breast cancer in this country.
Right. Thank you, Dr. To. I understand that if you're in support of that, you have a blue ribbon.
Yes.
Tell us about the blue ribbon. Why the choice of the blue ribbon?
So lung cancer color is meant to be white,
right.
But white is a color of surrender and defeat, and it's also a color in Chinese which is a bit pantang. So we've changed it at our Liberty to blue, strong blue, bold blue, Blue November.
Blue November. So if you're in support of Blue November, put on your blue ribbons. You don't have to purchase one, just buy a ribbon and tie it on in support of lung cancer awareness, and share your thoughts on lung cancer awareness when anybody asks you about it. Thank you, Dr. To.
Thank you so much.
Consultant clinical oncologist and co-founder for Lung Cancer Network of Malaysia. Thank you for spreading the word. And for viewers out there, thank you for staying tuned to The Nation. That's all for now. Bye.
Bye.